Hello, thank you for attending the Grifols inclusive demonstration of Kiro Oncology. Kiro Oncology is a fully automated hazardous compounding device for the preparation of patient-specific doses and small batches using liquid or lyophilized drugs. Investing in the future today speaks to the very foundation of what your sterile compounding practice stands for in meeting the clinical needs of your patients tomorrow. You also demonstrate your commitment to ensuring quality, safety, and compliance with USP 800 and other established standards and regulations. By attending today and learning about the benefits of technology and automation, you are showing that you want to be at the forefront of IV sterile compounding advancements. The benefits of technology and automation are far-reaching, and whether it's safety and quality, flexibility and efficiency, accuracy and precision, or cost savings, Kiro Oncology can help improve compounding practice. Kiro Oncology is designed to help protect your patients and staff. As a Class II Type A2 biosafety cabinet, it allows for direct loading of materials in their final working position to minimize cleanroom movements and maintain aseptic processes. The device also minimizes risk of exposure to staff, ensures sterility, and enhances dosing accuracy of preparations through automation of critical compounding operations within a closed aseptic environment. Kiro Oncology's universal vial adapters accommodate varying sizes and suppliers of vials. Interchangeable adapters accommodate syringes, IV bags, elastomeric pumps, and cassettes. This helps standardize workflow, facilitate flexibility, and potentially generate cost savings, all while maintaining productivity. Two robotic arms work simultaneously to complete different compounding tasks and minimize production time. The robotic arm on the left is for dosing, needle capping and uncapping, syringe capping, and syringe disposal. The arm on the right is for vial label scanning, reconstitution of lyophilized drugs, unfinished vial storage, and disposal of empty vials. Two peristaltic pumps assist the robotic arms for fast and accurate reconstitution from large diluent containers. They also allow the user to pre-fill diluent in empty containers with accuracy and traceability. Barcode scanning, source vial label image analysis, and double gravimetric checks allow for full traceability of the compounding process for each product. This helps ensure the correct drug, dose, and final container will reach the right patient. Kiro's self-cleaning system helps prevent the accumulation of hazardous chemicals while standardizing the daily decontamination and sanitization process. This automated self-cleaning process also protects staff from the risks of manual decontamination. As you can see, Kiro Oncology can help enable your pharmacy team to practice at the highest level of safety and quality when preparing hazardous sterile products for patients. Now, we will prepare and run a cycle, so you can see exactly how the device operates. For this demonstration, we will be preparing 3 patient-specific preparations, 1 IV bag, and 2 syringes with tamper-evident caps. The operator will use the touchscreen to select the desired patient-specific preparations to be compounded. Kiro Oncology can be integrated with your hospital's information system by using a bidirectional feed to receive compounding orders and send back information on the compounded preparations. Once preparations are chosen and a cycle is launched, the system will list which compounding materials are needed and instruct the user on how to load them. All materials should be wiped down with alcohol and introduced into the compounding area using aseptic practice. The final containers will be pre-processed before being loaded into the device. The user will be required to scan the barcode to verify it is the correct IV bag for the patient's specific dose. A preparation identification label will print, and the user will apply it, then record the initial weight. Once all final containers have been pre-processed and all materials presented on the screen have been reviewed for loading, the user will confirm the end of pre-processing. Kiro Oncology now starts the launch loading phase, where the window opens and materials are aseptically loaded. The user will then follow and complete the loading instructions on the screen, progressing with the internal touchpad to maintain aseptic practice. Now the user starts the loading process of the compounding materials, final containers, syringes, vials, and caps, or closed system transfer devices. Because the final containers are stationary, IV sets can be attached and optionally primed before loading. An internal barcode reader verifies correct final containers and vials. Then, sensors verify proper loading and location. The syringe carousel uses a vision recognition system to validate the proper loading position, syringe size, and needle attachment. Kiro Oncology makes use of universal vial adapters to support any brand or size vial from 0.5 to 100 milliliters, and interchangeable adapters to support syringes of 1, 3, 10, 20, and 50 milliliters, IV bags up to 1 liter from major manufacturers, elastomeric pumps and cassettes, CSTDs, and tamper-evident caps. It can accurately transfer doses as small as 0.25 milliliters to final product syringes and 0.6 milliliters to cassettes, elastomeric containers, or IV bags, making it ideal for pediatric dosing. The loading capacity per compounding cycle includes 8 final container products, including IV bags, elastomeric pumps, and pump cassettes, 8 syringes, 12 new vials, 10 partial vials, 4 syringe caps or closed system transfer devices, 2 diluent containers, either different diluents or the same, to avoid cross-contamination of the spike. Once the loading process is complete, the automatic compounding process begins. After the window closes, the first step is the recovery of any partially used vials from the storage area. After all the vials are in the vial carousel, the vision recognition will start to verify the vials. The internal camera double-checks the label of the vial with the database of label patterns. It will also record the lot and expiration at this time using optical character recognition. Here you can see the 2 robotic arms working simultaneously. The arm on the left is responsible for the handling of the syringes and dosing. The arm on the right is responsible for vial movement tasks, including identification, weighing, reconstitution, storage, and disposal. The arm on the right begins the reconstitution phase. The initial vial weight is captured, followed by the addition of diluent via the peristaltic pump. Once the diluent is added, the vial goes back to the internal scale to verify the weight or volume added. It then proceeds to the agitation step. There are 2 agitation speeds available, fast and slow. The slow option is more commonly used for monoclonal antibodies. While the right arm is reconstituting powder vials, the left arm prepares a syringe dose from a liquid vial. The left arm removes the appropriate syringe from the carousel and moves it to the capping station, where it removes the needle cap and then records the initial weight of the empty syringe. The robotic arm will then move to the laser sensor to record the angle of the needle. Most needles are tilted, so the arm corrects for this before entering the vial, bag, or back into the cap at the capping station. Kiro Oncology corrects for needle angle to avoid bending or coring as it pierces the vial. Its high-precision syringe pump withdraws the intended dose at the rate optimized for the drug's characteristics. The system confirms proper dose by weighing the syringe again. If too low, it will automatically return to the vial for correction and weigh again. Since this is a final preparation syringe, the system recaps the needle for safety, then discards it. It then verifies needle removal before applying the cap or closed system transfer devices. Kiro fastens the cap or CSTD to the syringe, verifies proper attachment, and returns the syringe to its carousel. Next, the left robotic arm retrieves the syringe that will be used to dose the IV bag preparation, following the same steps it did with the other syringes, bringing the syringe to the capping station and removing the needle cap, taking initial weight of the empty syringe, checking needle angle before piercing the vial, drawing drug from the vial, and weighing the syringe again to calculate accuracy. It records the needle angle again before piercing the middle of the IV bag injection port at the correct angle to avoid coring, damage, or leakage. Once the bag has been dosed, the left arm brings the syringe to the capping station to recap the needle, while the right arm drops empty vials into the waste disposal container. The arm replaces the syringe adapter, removing the empty syringe and disposing it in the waste disposal container. When changing the waste disposal containers, the user has no contact with the hazardous drugs or materials because of a double port system, which is airtight and locked into place with the bag. To minimize waste, the right arm places any usable partial vials into the storage area for future doses and drops empty vials into the waste disposal container. Once the compounding process has been completed, an alarm alerts the user so they may start unloading the final products following on-screen directions. When unloading the preparations, the user scans the data matrix on the label, and the screen requests a final weight check of the product. Once the weight is verified and within normal limits based on facility configurations, the final label is generated. These steps will be repeated for any other completed preparations in the cycle until all are labeled and ready for administration. Consider the 4 nozzles located at the top, in the back, and on the side of the walls. These are for Kiro's unique self-cleaning system. When ran, 18 liters of sterile water and disinfectant sprays onto the compounding area. The self-cleaning system avoids inconsistent cleaning procedures and staff exposure to hazardous drugs or chemicals with over 99% drug decontamination efficiency. Thank you for attending this Kiro Oncology demonstration. If you would like to learn more about this product or have any questions, we encourage you to visit grifolsinclusive.com and connect with us directly.